Well, good afternoon, everyone, and thanks once again for joining us here for a pretty important public announcement. I'm Dougal Saunders, State Member for Dubbo Electorate, joined again today by Scott McLaughlin, who's the CEO of the Western New South Wales Local Health District. Today we've got Brendan Cutmore here, who's in charge of Aboriginal health and wellbeing. He'll be talking to us about some of the operations that are now underway. The Assistant Commissioner and Commander of the Western Region for New South Wales Police, Jeff McKechnie, joins me today, and also represented here by Murray Wood, the CEO of Dubbo Regional Council. Look, again today, unfortunately for the Western New South Wales District, we have significant increase in numbers. 21 new cases of COVID-19 across the district, and all 21, in fact, are in the Dubbo region. That now means we have in Dubbo 59 confirmed cases. We have 4 still in Walgett, for a total of 63 confirmed cases across the Western New South Wales district, and that is up until 8 o'clock last night. Important to note, there are also 2 positive cases since that time, so overnight, that have been uncovered at Mudgee. So they are not included in that figure of 63, but I think really important to note that there are 2 confirmed cases in Mudgee, and I'm very well aware that that has got the people of Mudgee concerned this morning. One of the things to note is, and I'm aware, as you are if you're in Mudgee, that a business has come forward and nominated that it has had a positive case, and is asking people to be aware of that. I can assure you that the contact tracing teams are doing as much as they can, as quickly as they can, to identify if and when the close contacts are for that particular business, and as soon as we can, we will have that information up and available to you online. So at this stage, I guess it's up to you as to how you interact with the information that you're being provided, but 2 positive cases definitely for Mudgee. Around that, obviously, one of the things we do want you to do if you're at Mudgee is come forward for testing. With even the mildest of symptoms, if you have any concerns at all, now is the time to come forward. The AREC drive-through testing site is open and available through until 3 o'clock this afternoon, and it will be open again tomorrow as well, running 7 days a week. There is also the respiratory clinic, which is open only between 9 and 12, and only for patients that make a booking that have particular concerns around COVID symptoms. That's a clinic run by a GP, so a GP there. So don't just turn up to the respiratory clinic. You do need to make a booking with symptoms, and that's from 9 o'clock tomorrow morning. Lots of other questions that have come forward as well about locations of cases, of positive cases, and one that was raised yesterday was Wellington, which had been mentioned in the Premier's media conference. I can just once again confirm there are no positive cases of COVID at Wellington itself. I know it does get slightly confusing, but Wellington does not have a positive case, although it is noted that areas that were formerly probably in the Wellington Shire Council are now incorporated in the Dubbo Regional Council area. We're not going to name small localities, small villages or towns. If there is a case in Wellington, that will certainly be noted. Otherwise, all cases will be under the Dubbo Regional Council banner, and certainly any venues of concern would be updated. And on the venues of concern, we have listed them on this post right now. So if you are worried about where those venues are, just check the post right now, and all of those details are there provided for you. Look, again, the main message today is to stop where you are. Movement is the spreader, and we know with the overall lockdown across regional New South Wales, in fact across the whole state, the idea is to stop people moving around and spreading things. Our Assistant Commissioner can talk a bit more about the program involving our roads, lots of talk about caravans and what they need to do. He can go into more detail about exactly how that will do. But the message is, if you do not need to do it now, don't do it now. Stay where you are as much as possible. Look, one of the other main focuses we've got is trying to stop the spread within families, and Brendan and Scott can talk a bit more about some of the positive plans we've put in place, including actually housing people safely to make sure that we're stopping the spread. So that will come up in a bit more detail with Brendan and Scott. I do want to talk just to finish up with about some education scenarios as well, and also testing. Testing's been great. Scott will provide some more details, but again, over 4,500 tests yesterday in Dubbo, and over 7,500 across the district. Please keep coming forward for testing. School, of course, due to start again tomorrow. we are asking you, if at all possible, to keep doing the learning from home as much as you possibly can. If you can't, your children are allowed to go to school for supervision, but if you can, please keep your children at home. 98% of students on Friday did exactly that, so only 2% were turning up at schools, which is fantastic, and we had 18% of teachers in that in the Dubbo cluster that are actually at work. So as much as possible, what we want to see is that continuing. An update on some schools, and there is some not great news for some of our schools. Dubbo College South Campus will now be non-operational through until at least August 26, so a full 2 weeks of non-operation for Dubbo South. Unfortunately, a further 4 students and staff members have tested positive. Our thoughts and concerns are with them. All staff and students are now being asked to get tested and to isolate for 14 days. And all teaching and learning will obviously continue remotely during this time. But again, our thoughts and concerns with all of you. For Dubbo College Delroy campus, unfortunately this morning a confirmed case, a student testing positive. That school will be non-operational tomorrow for staff and students, and there'll be deep cleaning, etc. And again, all staff and students are asked to isolate at this point in time until further advice. Other schools that remain closed are Buninyong Public, Dubbo School of Distance Ed, and the Arana Heights Public School. Reopening from tomorrow is Dubbo West Public School and Macquarie Anglican Grammar School. Both have been thoroughly cleaned, but again, operational tomorrow, but only if you need your children to be there. So please do what you can to ensure you can keep them at home if that is at all possible. Thank you very much, and I'll hand over now to Scott McLaughlin.
Thanks, Dougal, and good afternoon, everybody. This is another sobering day and a really concerning situation for us. With 21 new cases, all of those in Dubbo. 63 cases in total across the whole of the Western New South Wales region. We know that the vast majority of these confirmed cases, both overnight and through the last week, have been infectious in the community. This is time for us all to stop and stay. Don't move anywhere. There are people infectious in our community in Dubbo and in Western New South Wales. Overnight, as Dougal announced, we have seen 2 new cases in Mudgee. Both of those cases, contact tracing is still underway. We will provide more information as soon as that's available on locations of concern. But what I will say to people in Mudgee, now's the absolute time to come out and get tested more. We know that you've been doing that over the last week and 10 days. Now's the time. If you have been tested previously, please come out again. If you've got any signs and symptoms, then please come and get tested today. Our testing facilities are available at the AREC facility 10 a.m. to 3 p.m. today, so please hurry and do that. We know that the vast majority of our cases in Dubbo and across Western New South Wales are Aboriginal, and the vast majority of our cases also are children. We sadly have one admission to hospital overnight in a child. We have a lot of people in isolation at the moment across Dubbo and in other communities. We've been able to stand up 2 new accommodation facilities. Those are locations where we can bring people that are both confirmed cases, also close contacts and other essential workers that need isolation and support services. Brendan will talk more about all of the other support services that we're providing to the close contacts. In the last 24 hours, impressively again, we've seen over 7,500 tests done across Western New South Wales, and importantly about 4,600 of those in Dubbo. We want to see that continue to maintain at those levels, particularly in Dubbo. Across the rest of the region, please come out and get tested wherever you are. We know that the steps taken late yesterday to ask the whole of regional New South Wales and the rest of Western New South Wales to step into a weeks-long stay-at-home order is also a signal that we do have spread outside of the current locations. We do have new sewage tests that have come back positive in the last 24 hours. Both of these not new, one is in Parkes and one is in Walgett. And so please can I implore the communities of both Parkes and Walgett, come out and get tested. We've got drive-through clinics open in both locations, in Parkes at the showground and in Burke at the multi-purpose service or the hospital. Please don't delay in coming out and getting tested in those locations. We've now got 36 venues of concern across the whole of the region, the vast majority of those in Dubbo, 35 in Dubbo and 1 in Walgett. We will be updating that on a regular basis. Please keep your eye on the New South Wales Gov website on the COVID component of that. The public health order that's come into effect late yesterday across Western New South Wales, across Bathurst, Orange, Parkes, Forbes and the whole of that region. This is time for us to all, as a region, please come together. Stay at home today, don't go moving around. Don't let your kids go out and visit the neighbours' houses. Don't go and have a barbecue with your mates and neighbours. Don't go out shopping unnecessarily. The only way that COVID is spreading is in human-to-human contact. The more contact you have, the more at risk you are. The more at risk we all are from that. And so please, this is time to stay at home and don't move any further. We've stepped up our response for all of our hospitals to a code red response. That was late last week. We've again reinforced that for all of our staff, this is time to really protect yourselves with the right PPE, the right screening tools in place. We're asking for visitors not to come to the hospital wherever possible. We know that we've got patients with palliative end-of-life issues and also mums in labour. Those are the environments where we do want to have support people at the bedside and within the service. Can I finally say this is a situation that will continue to grow. We know that in the last 24 hours since 8 p.m. last night, we have seen more cases identified. Those numbers will continue to increase in the next 24 hours again. Please stay at home, protect yourself, wear masks wherever possible outside of the house, socially distance, use your hand hygiene, and if you do need to go out, make sure you check into facilities with your QR codes. And please take care of each other. This is time for us to all come together, show some love and appreciation for our communities and everyone. And thank you. I'll hand over now to Brendan Cutmore. Brendan's our Director of Aboriginal Health and Wellbeing, heads up both our public health response but also our engagement with Aboriginal people and our Aboriginal health team across the organisation. So I'll ask Brendan to talk us through some of the solutions and strategies we're putting in place. Thanks, Brendan.
Thanks, Scott. So I'm Brendan Cutmore, Director of Aboriginal Health and Wellbeing, Western New South Wales Local Health District. I'm a Gamilaroi and Yorta man from New South Wales. So first of all, I'll just talk about the services that we've got that are available for us right now. So we have an Aboriginal cultural support team available for all those homes where we have confirmed cases of COVID-19 and equally supporting as much as possible, all the close contacts around those confirmed cases. The cultural case support teams are supporting homes with things like food and medical resources by coordinating some runners that we've got on the ground that are some of our amazing Aboriginal health workers that you all know through your communities that are dropping off these resources to the homes. Outside of that, we've just brought on board some of our specialist social emotional wellbeing Aboriginal mental health clinicians that are available for anybody that's struggling in the home with all the circumstances of the things that are happening at the moment. Please don't be too proud in terms of reaching out and asking for help at the moment. If you're struggling and you want some help and you need someone to have a conversation with, we've got some specialist people that are here that can help you, that are equally people that you know that are from the communities around this footprint. Outside of our cultural support services, we equally have available for anyone that's in extremely difficult circumstances and can't reach any of our testing that's available across Dubbo. We have an Aboriginal mobile testing team that's travelling out to homes to undertake testing at the place of residence. Now, if you're one of those people that will be accessing that testing service, you'll be informed of the process that you'll need to follow around that. And we're bringing that service to you because we accept that these are extremely difficult times. There are a number of other support services as well that are currently galvanising themselves or getting themselves ready to make other resources available for you, like food and support with some of the medical supplies that I'd spoken about before. In the interim, as those services are getting themselves ready, my team that are here will continue to keep supporting you as much as we possibly can. The part that I want to say to everybody at the moment is that right now, through any crisis, normally our community response and our family response is that we gather together and we normally share our resources, and we normally take care of each other in the way of pulling everybody together in, at Nan and Pop's house or at Auntie and Uncle's home. But right now we've got to do this in a very different way, and that is that I really need to encourage everybody to stay in their home. And I've mentioned already the support services that are available. Those support services will be the services that will support the families. So don't go down to Nan and Pop's house or to Auntie and Uncle's house to drop anything off to people or to check in. Use the phone, send a text, and if you're really worried, contact us and we'll ensure that the support services reach out to help your family. Right now, the way that we stop this spread is that we stay in our own houses. And equally, for our kids, our little ones that are running around and they love playing footy with each other, they love playing chases out the front, they love riding their bikes, etc. Our kids have got to stay at home as well. Because at the moment, some of the spread that we're seeing is amongst the children in our community, and we need to protect our children as much as we need to protect our elders. I'm now going to pass it over to Assistant Commissioner Jeff McKechnie, who will speak about the police response.
Thank you, Brendan. Some really important messages there for our community, and we're all part of the same community here in Western New South Wales. From an emergency management perspective, once the statewide lockdown was notified yesterday, all of our local emergency management committees across the region have come together, and they bring together all the services, police, emergency services, local government, other government agencies in those locations, bring them together to focus on this problem. Now, for some of them at the moment, they're going to be largely about supporting testing and supporting vaccination. Others, where there are actual COVID cases, will certainly be focused heavily on compliance and the testing and vaccination. But as Brendan mentioned, there's a lot of services, a lot of help available for people if you just reach out. There's no need to leave your house to go and help someone. There's no need to go shopping unnecessarily. There are people available who can assist. If you just stick your hand up, make that call, make that contact, and get that help you need to your house. It really does stop that movement that we're looking to minimise at the moment. From a policing perspective, last night here in Dubbo alone, Dubbo Police District and the little towns around it, we issued 20 tickets, 20 infringement notices for non-compliance with the health order. Now really, you've got to ask yourself, what is that about at the moment? Why aren't people heeding the messages that we're all sending to stay home? We really need to look after each other, look after our families. The health professionals have told us this COVID at the moment is impacting on children. Half our cases are young children. What greater motivation could there possibly be for us as a community, as a group of people, to just abide by some very simple rules at the moment? Stay home and look after yourselves and your family. Keep everybody safe. Now, if you can't do that, from midnight tonight we're kicking off Operation Stay at Home across the state. The infringement notices that we issued last night are going to be 3 times the amounts tonight. The most basic infringement under the health order tonight is $3,000. No one wants to be issuing those tickets. No one wants to be getting those tickets. So the message is so simple. Stay home. Not only do you protect you and your family and your community, but you also stop the likelihood of you having that burden to face down the track of that massive fine. So please, work with us, all come together, We need to push on through this next 5-6 days, get those numbers down, but more importantly, make sure we all get to the end of those 5 or 6 days together and still healthy. Thank you.
Jeff, do you want to mention caravans?
Yeah, we've had some contact around caravanning. If you are caravanning in this area at the moment, in Western and far Western New South Wales, Central Western New South Wales, your holiday is over. There's no caravanning holiday. You either stay put where you are and you abide by the lockdown rules, or you go home and abide by the lockdown rules. Do not be moving from location to location. If you are, we will fine you and we will give you that ticket. It's as simple as that. Park your caravan somewhere, either stay in it, abide by the lockdown rules, or drive your caravan home and abide by the rules there. If you're stuck by the other state borders, stay where you are. It's as simple as that. Thank you.
Thanks, Jeff and Scott and Brendan. I might just finish by saying, look, what we're seeing here is an extremely good collaboration between local council, between health and police and the state government, all for the benefit basically of our entire population. So thank you for everyone who is collaborating on this. There have obviously been delays again with some testing. We're encouraging you to come forward for testing. We do understand that sometimes those testing times are taking longer than you would like. After 72 hours, there is a number to call or several numbers to call. In some cases, testing results are coming back fairly quickly, in other cases not. All we can do is ask you to be patient. Also on this link, we've added some details of some possibility of actually applying for some support around if you are being tested and isolating and not able to earn money. So that'll be a link on this Facebook post as well if you want to get some more details around that. The main message is don't move, try and be supportive of each other and tell everyone you know, stay where you are unless you absolutely have to do it. We'll be back again tomorrow with another update. Thank you.